All right, thank you. Good morning, everybody. Welcome to the 30th annual course here in Atlanta from the International Antiviral Society USA. And I'm Jeff Lennox. I'm one of the moderators here today. And my co-moderator, Dr. Michael Saag, who's been leading this course for the last 30 years and allowing me to participate on it with him. And I'm one of the faculty here at Emory University, and welcome to Atlanta for those of you who are attending in person. And this is our first in-person course in the last 2 years for our organization, and we're all very excited to have you here. So the course today, we have about 125 people attending in person and around 230, 235 people attending remotely for the course. And the people that are in attendance are from as far away as Peru and Canada. And
You don't need to move the slides forward.
Oh, they're not.
They're catching up with us now. Okay, good.
Okay.
Yep.
Okay, and I already covered who we are briefly. And here's what the numbers I was giving you. And particularly, we want to welcome the 17 fellows that are joining us today, infectious disease fellows, and also residents and other trainees that are here with us today. So the International Antiviral Society USA is accredited by the ACGME for medical education, and it's up to 5.25 credit hours. And some of this for physicians, you can also count it for your MOC credit, your MOC, Maintenance of Certification. And this just shows the types of points that are available for nurses, pharmacy, and physicians, and other licensed professionals that need the CME and MOC. The grant support, this course is generously supported by various pharmaceutical manufacturers and others in the healthcare industry, and we would like to acknowledge them and thank them for this support. They have no input, control, or anything with the content or the selection of speakers, but they do support our ability to continue to provide this training. Oh, go back. Information about financial relationships. Many of the faculty are engaged in clinical research, and you will see that in our financial relationships what they are in this e-syllabus book when you download that and go through it. Now, we did a pre-activity knowledge practice assessment, and there was several questions. The average score was about 40%. And that either means that we did a really bad job writing the questions, or that there is new information that we're going to be transmitting and talking about, and hopefully people will do better on the post-course assessment, and you'll get some new information today that'll be valuable to you. Now for question submission and polling, I'm sorry, I'm going to introduce Dr. Michael Saag, who's going to take over from here. Mike?
Thank you. So this year we're using Slido, which you can think of whatever pops in your mind when you hear that. But Slido is a software program, and probably the best way to access it is through the Q code or QR code right there. So you take your phone or your whatever laptop or whatever and take a picture of that, and it'll take you to the site. Or you can join it by just going to slido.com. And I guess the other thing I didn't say, at least for people who are here in the room, you can access the internet just through the Cobb Galleria public Wi-Fi. So we're going to try this out here in just a second. The other thing about this is that there's a virtual chat, so you can see who's on, and you can chat with everybody, or you could chat with somebody individually through the Slido thing, much like what you do in Zoom. The speakers can't see the chat, but we will be doing all of the Q&A through Slido. So there's a Q&A button there, and you submit your question. It comes up to the moderator on an iPad, and then we will read the questions and give attribution to who asked it, and then we'll have a discussion about whatever's on your mind. So take a few seconds and join us on Slido. That's for people seeing things virtually as well as people here in the room with us. So we're going to try this. We're at slido.com. So we'll go ahead and try to get this working. So just a simple question. Are you here in person? Are you here virtually? Spiritually? That's not an option. Reverend Hamlin, thank you for being with us. Okay, let's go ahead and vote. I hear a mumbling of music, but I don't know what it is. And the land is dark, and the moon is the only light we'll see. Oh. So we're going to stand by this vote. Let's go and see how it played out. Oh, I need to do that. Ha, thank you. All right, so we have about a third of people here in person and 2/3 virtually. Great. And now a straightforward question, what best defines your training? Go ahead and vote. We did on this. Okay, almost half are physicians and a lot of nurse practitioners and pharmacists, other people as part of the medical teams that we all have grown fond of and accustomed to using in our HIV practices. How many patients are presently under your direct care? So that doesn't mean how many are, for example, being seen at the Ponce Clinic or at 1917. This is how many people are in your panel of patients that you provide care to. Go ahead and vote. And for some of these, you may need to slide Slido up and down. I think I could say something more clever than that, but. Okay, let's see what that looks like. All right, that looks like a reasonable number. So folks are not exactly overwhelmed, but that's a good number, 100 to 300. Some 14% more than 500 busy people. How many in-person CME activities have you attended? Now that's not virtual, just have you actually been in a room and attended in the last 2 years? Let's go ahead and vote. Been to more, less than 5 or 6% have been to more than a couple. And did you attend, now in this case it would be virtual by definition, did you attend or participate at all in CROI 2022, which was just a month ago or so? Go ahead and vote. This time of the day. All right, so most people did not. So we're going to be reviewing, in fact, and our next speaker was going to talk about this, so this is great. The PowerPoint presentations will be available after the course, and handouts are available, an e-syllabus book that you can get online where you register with IAS-USA. So this is our events for the day. Dr. Gandhi is going to pick up with CROI 2022. Then we're going to have a case panel discussion that I'll lead along with several of our faculty, Q&A session there, and then we'll hear about frailty from Dr. Thompson, and especially what do you do about it? I mean, we know it happens, but is there anything we can do and make a difference? Have a break for lunch, and then come back with controversies on STIs, what's happening. That'll be a case-based discussion. So look, the guidelines came out about a year and a half ago. So how is that playing out in our practice? And we'll sort of see where we are. And then a really exciting talk about screening for anal cancer. And there's a brand new study called Anchor that Grant Ellsworth is going to share with us, but other practical issues about how to do this. Take a Q&A, and then come back with a virtual presentation from Dr. Dawn Smith at CDC, who's going to talk to us about how to optimize PrEP. Brief Q&A, and then have a quick break, and then come back with something that I think is really exciting. We did this in San Francisco associated with a Ron White meeting in the fall. And we decided in all the cities where we're coming back in person, we're going to talk about what was the epidemic like in the very early days. Because most of the people who are practicing now or participating in clinics weren't around back then. I mean, it might have, some of you weren't even born, but even if you were, you weren't probably engaged in HIV care. And so this is a way of just looking back 40 years, 40 plus years now, in terms of what it was like here in Atlanta and in the Southeast. And so we've got a great lineup of folks who are going to talk to us about that, who are participating, some of them at CDC, and some of them in practice here in the community.